Hello friends, today we are going to talk about a very important disease known as Hashimoto's thyroiditis. Hashimoto thyroiditis होता क्या है बेसिकली कि पेशेंट का जो थायराइड ग्लैंड है उसकी इन्फ्लामेशन हो जाती है. This is an autoimmune disorder in which the body's own cells starts attacking the thyroid cells. So the immune cells of the body, they start attacking the thyroid gland cells and that results in inflammation of the thyroid gland. थायराइड ग्लैंड एक बटरफ्लाई शेप्ड ऑर्गन रहता है आपके सेंटर ऑफ द नेक, इन फ्रंट ऑफ द नेक, विच इज़ वेरी इंपॉर्टेंट एज इट प्रोड्यूसेस हार्मोन्स सच एज T3, T4 and TSH, which helps in regulating various functions in your body. So this is a very important in regulating and metabolic functions of the body, in regulating the temperature of the body. And इसकी जो प्रॉब्लम जब स्टार्ट होती है तो पेशेंट कैन हैव सिम्टम्स which can start from very mild symptoms or unrecognizable symptoms, such as patient may have severe weakness, tiredness, fatigue. कई पेशेंट्स के अंदर देयर स्टार्ट्स हैविंग ड्राई स्किन, कॉन्स्टिपेशन हो जाता है पेशेंट्स को, एंड इन सम केसेस ग्रेजुअली दे स्टार्ट हैविंग वीकनेस, मसल सोरनेस एंड वीकनेस ऑन एक्सर्शन. कुछ केसेस में पेशेंट की सेंसिटिविटी टूवर्ड्स कोल्ड इंक्रीज़ हो जाती है और दे आर नॉट एबल टू कीप देमसेल्व्स वार्म इनफ. कुछ केसेस में ये भी देखा जाता है कि पेशेंट को टायर्डनेस के अलावा और कॉन्स्टिपेशन के अलावा पफीनेस आ जाती है अंडर द आइज, फेस में ब्लोटिंग आ जाती है, कुछ में लेग्स में और लोअर लिम्स के अंदर वीकनेस आ जाती है और एडीमा हो जाता है या हैवीनेस हो जाती है लेग्स में. सो दीज आर सम ऑफ द कॉमन सिम्टम्स दैट आर सीन इन दिस कंडीशन. नाउ पेशेंट को ये होता क्यों, ऑल्दो इसका as such there is no known cause that is confirmed ki what causes it, but there are some triggering factors that have been found to be responsible for this condition. So इसके अंदर देखा गया कि usually in patients who have been exposed to radiations like excessive radiations, कई बार लोग बहुत ज़्यादा एक्सरेज करवाने लग जाते हैं, every month they go for x-rays or any other radiations, or those who are going for some radiation therapies. In those cases this condition can develop. Then in women, especially in pregnancy, this condition can develop, and it has been seen that in almost 20% women after pregnancy they develop gestational diabetes along with this condition. Then there is also other causes. There may be some triggering factors like excess stress in the life of the patient, or there may be other injuries to the glands, thyroid gland. In those cases also this thyroid gland can get swelled or has its inflammation. और जब ये इन्फ्लामेशन होती है तो उसके कारण जो हार्मोनल बैलेंस है बॉडी का, खास करके T3 एंड T4 का, वो इम्बैलेंस हो जाता है. एंड दिस कंडीशन में इनिशियली लीकेज हो जाती है पहले तो थायराइड हार्मोन्स की, क्योंकि इन्फ्लामेशन होने के कारण जो T3 एंड T4 है वो बढ़ जाता है. और दिस कंडीशन को हम हाइपरथायरॉयडिज्म की तरह भी कहते हैं. बट ग्रेजुअली आफ्टर सम टाइम इफ़ द कंडीशन इज़ नॉट रेक्टिफाइड तो ये कंडीशन फिर हाइपरथायरॉयडिज्म की तरफ चली जाती है. इन दिस केस द थायराइड हार्मोन्स दे आर स्टॉप्ड प्रोड्यूसिंग फ्रॉम द थायराइड ग्लैंड. तो ये जो थी कंडीशन हाशिमिटोस की, इट इज़ इम्पॉर्टेंट कि मैनेजमेंट इसका बहुत प्रॉपरली किया जाए. So the first important thing that needs to be done by the patient is to maintain a very active lifestyle. They need to start exercising every day. At least half to 1 hour walk is recommended for such patients. देन इन्फ्लामेशन क्योंकि बॉडी में हो जाती है इस केस में, तो इसके अंदर anti-TPO एंड anti-TTG जो एंटीबॉडीज़ हैं रिलेटेड टू द थायराइड ग्लैंड, they increase very much in high rate. So to bring those to normal condition and to lower the inflammation, it is recommended that patients starts taking vitamin D supplements in their diet. It has been found that this has improved condition in patients who have been basically suffering from this condition. Then also they are recommended to intercurrently take supplements of vitamin E and vitamin C. Also it is important that they limit the intake of gluten in their diet. ग्लूटेन जो कि बेसिकली वीट प्रोडक्ट्स में पाया जाता है, बिस्किट्स, केक्स, पेस्ट्रीज एंड ऑल दोज मैदा एंड ऑल दोज काइंड ऑफ स्टफ, दोज शुड बी अवॉइडेड बाय द पेशेंट हु हैज़ हाशिमोटोस. इसके अलावा दे शुड गो टूवर्ड्स अ मोर हेल्दी लाइफस्टाइल चेंजेस सच एज टेकिंग मोर products that are rich in foods such as kale, broccoli, more like cruciferous vegetables जिन्हें हम कहते हैं. तो जैसे कि गोभी के जो फैमिली से रिलेटेड होते हैं, those kind of vegetables they should more include in their diet, at least one serving every day if possible, especially during the winters. And then they should increase the intake of more fruits and veggies in their diet. So 2 servings of fruits and at least 2 servings of veggies every day is usually recommended for such patients. इसमें ये भी देखा गया है कि पेशेंट को जब इन्फ्लामेशन होती है तो उसके करके उनको स्वॉल्विंग में कईयों को दिक्कत आ जाती है, क्योंकि आपका जो थायराइड ग्लैंड है वो नेक के बिल्कुल पास होता है और आपकी विंड पाइप एंड फूड पाइप से रिलेटेड रहता है. सो इफ़ इट गेट्स टू मच स्वोलन then that can in some time cause patient to have difficulty in eating or swallowing their food also. Also it is seen that in patients who have deficiency of iodine in their diet, or in those who have this condition, or in those conditions also proper intake of iodine should be taken, because sometimes deficiency of this can also prevent its treatment. So it is important that you get connected with your homeopath or the concerned doctor, and then go for the tests as well as the proper diet management after consulting the concerned doctor. And once the treatment is started, follow the protocol properly, because this condition can revert back because it is an autoimmune disorder. सो अगर कोई भी कॉजेटिव फैक्टर रहा तो वो पेशेंट को अगर मैनेज करके प्रॉपरली क्लियर अप किया जाता है केस, बट अगर पेशेंट खुद अपनी तरफ से एफर्ट्स नहीं लेता है एंड दे डोंट मैनेज देयर केस प्रॉपरली, देन दिस कंडीशन कैन रिवर्ट बैक एंड कॉज लॉन्ग टर्म complications in the later stages of life, which can be very severe and life threatening also. So इसके अंदर it is important कि कुछ conditions में जहाँ पे ये control नहीं रहता, they can affect your metabolic conditions in the body, they can affect the heart, they can affect the thyroid and the intestine की inflammation होने लग जाती है patients में, which can lead to celiac disease and other more chronic diseases of the intestine. Constipation होगा तो patient का अगर digestion सही नहीं है, then that could further aggravate the condition of the this problem. So it is important that the patient properly manages his case by consulting their doctor. Also it is important that they take the proper supplements as recommended with the proper dosage, and don't overdo it, because anything in excess is bad. And also it is important that the patient lead a very active lifestyle to prevent this condition from causing more damage to the body. Also it has been seen कि इसके अंदर जो condition है in pregnant case ladies के अंदर we have seen कि ये patient जो during the first trimester or second trimester अगर ये condition develop हो जाती है तो it is really difficult for the person to be treated unless they take initiative themselves along with the medicines. हमारे पास काफ़ी अच्छी होम्योपैथिक मेडिसिन्स अवेलेबल हैं इस कंडीशन को ट्रीट करने के लिए. एंड आई वुड लाइक टू शेयर अ केस हियर इन अ ब्रीफ वे. We had a patient here which was a lady of about 27 or 28 years old. During pregnancy, she has developed Hashimoto thyroiditis, and along with that, gestational diabetes. The TPO and anti-TTG levels were almost more than 900, uh, which should actually be lower than 10. So this patient was under treatment and is still under treatment for the past 4-5 months, and gradually the TPO levels have reduced from almost 900 to 400, and the patient is improving gradually. She also has developed celiac disease. In the celiac disease, what happened was that the intestinal inflammation हो गया था उनका, and due to which the TTG levels were also way beyond the normal levels. So we were able to manage her case with the proper diet and proper dietary restrictions, advising her to follow the proper procedures to manage and how to manage her diet, to limit her gluten intake, and gradually her TTG levels are now almost normal. They are almost 0.80 now, and whereas before they were almost up to 600. And now she is improving gradually, and she had issues also with the menses, because after pregnancy she was having irregular periods, and for a few months she did not even have her regular periods, and she was quite upset about that, and a few doses of ferrum iodine were given for that, and she was gradually able to have her periods, and now she is having her periods regularly, and she's improving now, and hope that she in the future, like in a few months, she is able to get herself well and completely below normal. Her other levels are okay. It is important to tell you here that although her Hashimoto is improving, now her case is actually moving towards hypothyroidism. So that means कि अभी भी उसको ट्रीटमेंट का ज़रूरत है, एंड उसको अभी भी मैनेज करना है अपना कंडीशन को, because unless and unless she is able to bring her thyroid levels to normal, the condition can revert back. So we have advised the patient that she should be able to follow her diet properly and limit her gluten intake still, and to take the medicines regularly, because her condition, although is improving, she is not completely yet cured. So because this is an autoimmune disorder, so it is important that she manages her case by herself, and with the medicines gradually we are able to treat her Hashimoto's completely, and then we will move on towards treating her hyperthyroidism if that is not controlled further. So I hope you enjoyed watching this video and got some information about this rare and although very common condition that is now seen in urban areas. And if the patient follows all the treatment protocols and diet and make their lifestyle more active, this condition can be treatable, although not completely curable. But with time and with effort from the patient and the doctor, if they both work as a team, this condition can definitely be cured and improved upon. So I hope you liked the video, and in case you got some information about this condition, please like and share and spread the word. Thank you.